Hello, this is Dr. Lund, your Roseville neck and back pain relief chiropractor. Exercise to heal bulging disc versus herniated disc and the difference. So between each vertebra in your back and in your neck is a shock absorbing structure that's called the disc. And each disc has a tough outer lining and a soft inner part. And that soft inner part is similar to the consistency of toothpaste. And over time what happens is if you do a lot of sitting and a lot of lifting, the back of that disc can start to wear out, and you can get that disc can then start to bulge or it can herniate. So what's the difference between the two? I think the easiest way to explain it is if you think about a jelly donut. If the donut has deformed, there's part of it sticking out but the jelly is still contained, that's a bulging disc. If the jelly is squirting out of the donut, then that's a herniated disc. And bulging discs and herniated discs, these are quite common, especially as we age. So if we MRI people that are 45, in their 50s, and for surely in their 60s, we're definitely going to see some bulging discs and herniated discs. But here's the thing, whether it's a bulging disc or a herniated disc, the treatment is essentially the same. It's, what can I do to make your symptoms and to make your pain better? So let's go over a few recommendations before I go through the exercise. So the first thing is that prolonged sitting is the worst thing for our discs. So you want to make sure that when you are sitting, you're using good posture, whether you're sitting, driving, working in front of a computer. So you don't want to be slouched like this. Basically, you kind of want to sit up tall and put that slight arch in your lower back. What that's going to do is it's going to put less pressure on the back of the disc. Again, if you work at a computer, every 30 to 40 minutes, get up, take a break, walk around, move around. You want to break up those prolonged periods of immobility or where you're just sitting. And then the last thing I would recommend is to consider getting a sit and stand workstation so that you can go between sitting and standing, and that will also take some stress off of the disc in the lower back. So let's go through the exercise again. With any type of exercise that you're doing to help improve pain, the exercise should make it feel better. If it increases pain, don't do the exercise, stop doing it. You're not ready for it. So what this exercise is going to do is it's going to work towards pushing that bulge or pushing that herniation forward. So remember, the bulge, it's the back of the disc that wears out. So the bulge and the herniation comes out backwards. So what we want to do is we want to do things that push it forward. So the exercise is going to bring those bones closer together, push that bulge or that herniation forward, and then that can help improve symptoms. So it's pretty simple. You're just going to start out, and basically you lay down, and we want to extend back or put that arch in our lower back. So maybe you start out like this, you hold it for 60 to 90 seconds. If that feels good, then what we want to do is increase the height in which we're coming up. And you can get to a point where then you're on your hands, you're going to hold that for 30 to 60, 90 seconds, or 60 to 90 seconds. If this feels good, then you can even start to go up and down for maybe 10 to 15 reps. But again, this should all be feel good, pain-free, give you relief. And again, what we're doing is we're trying to push that bulge or that herniation forward. The other thing, chiropractic treatments work very well for relieving pain from bulging or herniated disc because it decompresses the joint, and it's doing the same thing. It's pushing that disc bulge or that disc herniation forward. So try the exercise out. If you did not obtain enough relief, give me a call, 651-779-5998. My goal is to get you out of pain as quickly as possible. I don't do any long-term treatment plans. I provide same-day appointments, same-day treatment. I'm in the office full days, Monday through Thursday, 8 a.m. to 6 p.m. So thanks for watching. This is Dr. Lund, your Roseville neck and back pain relief chiropractor.